to the first topic. So the first topic we're going to discuss today is stigma, particularly around diabetes and weight gain. And so to do that, we're going to have a small presentation by the team up the front. Renae's going to go first.
Hi everyone, thanks for having us. Just quickly, I'd like to acknowledge the traditional owners of the land we're meeting on today, the Aranda people, and to pay my respect to elders past, present and emerging, and of course pay my respects to all of the Aboriginal and Torres Strait Islander people here in the room with us today. For those of you who don't know me, I work in the Diabetes Across the Lifecourse partnership. Specifically, I bring the social science sort of lens to the work that we do, and over the years I've worked in diabetes in pregnancy, and more recently have been leading the Youth Type 2 project across Northern Australia. Why I'm here right now speaking to you about stigma and diabetes and weight-related stigma, sorry. I really should have a coffee or something at this point of the day, is because the work that I've done in our qualitative realm has really shown us that for Aboriginal and Torres Strait Islander women who live with diabetes in pregnancy, we know that stigma and shame, it can be a very real experience for them. And it can be a very real experience specifically around weight-related conversations. But we've got Anna who will talk a little bit more in depth about that. Oh no, technology. Is it the green button? Excellent. This is a definition of stigma, which I'll read to you. It's from the literature, and it says, stigma is a powerful social process that is characterised by labelling, stereotyping and separation, leading to status loss and discrimination, all occurring in the context of power. Stigma can look really different depending on what context we're working in and for what population stigma is real for. And so this is a really quite generic definition, but it's just one that's really important to flag today because the following conversation will be around where stigma exists in some of the work that we do and how that impacts the people that we work with and for. And so I suppose just quickly as well, I just want to flag that in some instances stigma is related to shame, and we know that this is often because people don't want other people to know necessarily about their condition, their diabetes diagnosis, for example. It comes around from things like not wanting other people to see them, people injecting their insulin, for example. That's something we hear a lot. There's a lot of stigma and shame around that. But really, it all comes back to people not necessarily wanting diabetes to be their identity. They are not diabetes. Diabetes is a part of their life story, but it should not define who they are. So some of the data extracts or quotes from young people who we've been working with across the territory who are living with type 2 diabetes, so those between the ages of 10 and 25, they've been talking a lot about how they feel ashamed about their diabetes diagnosis, and how this also leads to feelings of isolation, so how they might isolate themselves from peers because they don't want other people to know that they've got diabetes. And it also, sometimes it's related to a shame within families because young people have got very complex lives and diabetes is not their only story, and so they might have caring responsibilities or other really important aspects of their lives that they don't want their diabetes to interfere with. And so by having this big diagnosis, there's shame then around the other identities in which they have. And so just some of the extracts that came out of this paper that we recently published was getting shame, other mob, other young people, they keep it a secret. I felt like I was a burden, and you don't want your friends to be sad for you because you're sick. You want them to treat you as normal, not as a sick person. And before, I wouldn't want to tell you my story at all because I was pretty much at first, I was ashamed of it. One really important finding from our work so far is that even though we know there's a really high rate of youth type 2 diabetes in many of the communities that we work in, a lot of young people don't realise that there are other young people living in their communities with diabetes. And so part of the work we're doing is to try and connect those young people to develop peer support networks that will then break the shame and stigma that they're living with. But more importantly, we have somebody here, Jayde. I'd like to introduce Jayde to everybody. Jayde works with us on the Youth Type 2 project, and Jayde lives with type 2 diabetes, and she has some very strong stories of shame and stigma that she would like to share with us today.
Hello? Hi. So yeah, I got diagnosed with diabetes in my early teens, and when I got diagnosed with diabetes, it was like a shock really to me, because I thought it was an old person's disease. I didn't think teenagers would get it, you know. But yeah, and it was just shocking to hear that more and more teenagers, as the years go on, are affected by it. And you know, at school, it was all right. I mean, I had like my tablets at home, and then I'd go to school. Everything was fine, but then the scary parts were when I'd go on excursions, and I'd have to bring like my Ziploc bag with my metformin and all of that insulin and stuff, and it was just I was feeling like so left out, because I didn't see any other teenagers with diabetes in school. I mean, there may have been, but they definitely didn't share it with me, because it was like shameful enough, you know. And yeah. Yes. It would have been nice. It would have been really nice to have been told when I was diagnosed at Dinadilba that there were other kids my age and younger kids, like. God. Like there are other teenagers that are that have diabetes too, and not only diabetes, you know, some teenagers who got pregnant too, you know, gestational diabetes. So the lady said, yeah, she didn't she didn't say anything about it, and she left me, like, she just gave me the pamphlets and the information and in metformin, and just shoved me out of the front door, you know, kicked me out, and that's about it. And you know, I later found out, like, when we had like this get together with us girls, like there were a few girls that I went to school with. They were they were diabetic as well. Sorry, they were diabetic as well, and I was like, damn, I didn't know you were diabetic. Like, why didn't you tell me? Like, we were in stars and all, you know. And I mean, she did a pretty good job, like, at hiding it, where I just got sick of it, and I was like, yes, I'll take these very big pills, like morning, breakfast, lunch, and dinner. So yeah, it is what it is. And when I'd whip out my insulin, they'd be like looking at me, and I would like, you know, I like the reaction when I'd like stab myself. And mind you, the needle's actually that tiny. So it didn't really like go all the way to my guts and blood coming. No, it wasn't. And yeah, that's about it. Thank you.
Thanks very much, Jayde. So my name's Anna Wood. For people who don't know me, I'm an endocrinologist in Darwin and also a researcher at Menzies. I also work in a weight management clinic up in Darwin, and it's been such a privilege to work in that clinic and to get to walk, I guess, hand in hand with people through their weight journey. And these are just a couple of quotes from people in the clinic. And really everyone, or the vast majority of people, talk about experiencing weight stigma in their lives. So the first one, they're always wanting top off, but why I got to do that? Feels like no need for all the weighing. But a man's experience of feeling like he's being unnecessarily, his weight being talked about and weighed all the time. And the second quote, everyone looks at me. I want to eat food in my car so no one can look at me. I know what they're thinking. It's from a lady just really expressing how she feels that people are judging her for her weight. And so I think there's this real disconnect between what we know about the biology of obesity and what often is the common perception around obesity. So this idea that people living with obesity are, lazy or weak-willed and it's their own fault. And this is an Australian study. 53% of people living with obesity report having inappropriate comments from their doctor about their weight. And I think there's even, perhaps within the medical profession, this idea that maybe even stigmatising people is justified and necessary to, shame people into doing something. But of course, they're opposite effects. So there's real psychological harm, and really what just happens is that people stop engaging in the health system, really. But I think it is really tricky. I think it's a bit easier for me in a weight management clinic. People know we're going to talk about their weight, but in other clinical settings, I do find it tricky, and I know lots of other health professionals talk about this. That as health professionals, we want to talk about obesity, but we're also conscious of not shaming and offending people by bringing up people's weight. We know that obesity leads to lots of conditions, but we also don't want to attribute everything to somebody's weight. And there's plenty of examples of people, presenting to emergency department with abdominal pain to put down to their obesity and, late diagnosis of appendicitis. It's a really common scenario, that sort of thing. And we know that people have more pressing issues than obesity, that their weight is just one thing in their life. But we also know that obesity is contributing to lots of medical conditions. And we want to explain to people that obesity is not their fault. It's a complex, genetic and epigenetic process, but we also want to try and get the message across that we can change the obesity story. So I think it is a tricky thing sometimes as a health professional, but I think the important thing is that we try and that we're respectful, and that it comes from a place of compassion. So this is the Weight Issues Network is a great organisation led by people with lived experience of obesity. And just a sort of few ideas about, about tackling stigma related to obesity. I think language is important. It's about thinking about the words we use, about people, their obesity not being part of someone's identity, but it's a condition that they have, and not to make assumptions about people's knowledge. Just because a person has obesity, it doesn't mean they don't know anything about healthy eating. And it's not always the right time for people to be talking about their weight. And of course that there's not one solution for everyone. So in terms of what we should be doing, it's really focusing on that health and well-being, so often focusing on the complications of obesity, not weight per se. And just those approaches about listening to people's stories and considering what's feasible for people at that point in their lives. So I'll hand over to Ruth to set the tabletop questions.
Okay, session number 1. The way we're going to run this is as you come up with ideas and solutions, we're going to get you to write those down on it'll be a mind mapping exercise where you write the answers down on a piece of paper. But for this first question, this is just going to be a general topic of conversation at your table. So for the first few minutes, I want you to talk on your table, reflecting on all of the stories that you've heard today. Of the people with lived experience and things that have been found in research. How does stigma, particularly around diabetes and weight, how has that affected people's journey with diabetes? So if you want to just brainstorm that around your tables for a couple of minutes, and then we'll dive into the first